Good morning, and thank you very much for joining us. I am Yori Folani, alongside my colleague Asukwa James.
Good morning, Nigerians.
Indeed. Well, first of all, we start off by condoling the presidency on the passing of the chief of staff to the president, Malam Abba Kyari. We also condole with his family. May his soul rest in peace. COVID-19, the battle continues. I was reading one write-up, on the late chief of staff, and I think it was by Fashola, Abiyare Fashola, who had said that to honor him, we really must continue with vigor this fight against COVID-19. He would have loved that. That is what he would have loved, to rid this country of the scourge of COVID-19. But as we speak, the figures are not getting more encouraging. What are the latest figures as well?
Well, the latest figures are, just like you said, they are not encouraging at all. Right now, Nigeria has about 627 confirmed cases. Yeah, and even states that we are not thinking of, state like Jigawa has joined. Borno also has one, but the one confirmed case is death. The person died. And Lagos is still the epicenter.
Lagos is the epicenter.
376. In fact, Lagos, yesterday, the confirmed cases from Lagos was 70. This is the highest so far.
70.
70 in one fell swoop.
Even as Lagos continually is announcing discharging patients.
But
the rate at which people are falling sick, far outstrips.
Exactly, and that is why the Lagos State, like yesterday, the Commissioner for Health, said that they will now want to break down, the sampling collection centers, so it becomes easier for them to get to people, in trying to see how they can cut down the circle, in terms of the community transmission. So the 20 local government areas in the states will have sampling collection centers where people can just walk in. If you feel that you have symptoms of COVID, you can just go there and then they get your samples.
Okay, we're going to talk about that. In fact, that's going to be our theme today. The whole question of how some people seem to be developing a sense of stigmatization about it. We'll talk about this with the experts that we have lined up. But we've been hearing of cases who have been telling us how they have weathered it, how they survived it, what it was like when they were battling it. But stigmatization is another angle, and it is affecting the fight. And so we shall be concentrating on that today. In fact, even before we go, Asko, we have a report, I'm told by our producers. Let's take that report.
Another daily briefing from the Presidential Task Force on COVID-19. An opportunity to monitor developments made by the government in the fight against coronavirus, dispel rumors, and discourage fake news. In attendance are the Secretary to the Government of the Federation, the Director General of the NCDC, and other regular faces of the Presidential Task Force team. Addressing a plethora of issues on Nigeria's battle against the coronavirus, the chairman of the Presidential Task Force on COVID-19 notes that the country witnessed the highest single-day rise in the number of confirmed cases on Wednesday. For him, this is not the time to relax the lockdown order on major cities.
I believe we will learn very good lessons and we'll begin to deal with matters and deal with ourselves in a different way. I expect that our security agencies will be polite in interrogating whoever desires to have access during this time of lockdown.
Lagos is the epicenter of the coronavirus, and tension is rising, compelling some infected residents to resort to self-help. But the team is worried about this and has issued a stern warning to health professionals against treating patients with symptoms of COVID-19 outside accredited facilities.
We cannot afford to have avoidable morbidity and mortality. Private facilities must obtain accreditation in order to be allowed to treat this highly infectious disease.
The task force also appeals to Nigerians to stop stigmatizing patients discharged after the COVID-19 treatment, as such will be counterproductive to their efforts.
It is not karma. It's not coming back to you because your forefathers did something wrong. It is just the virus. And we have to really think about how we treat people and how we continue allowing the humanity in us to always come through. The people that are infected have families just like every one of us.
According to the Minister of Foreign Affairs, Nigeria has selected 2 airlines to bring back Nigerians stranded in various countries around the world, but there is an underlying challenge.
The numbers are high, and the places where we can isolate them are not enough for those numbers. So we will have to do it in a staggered fashion, and together with the National Emergency Management Agency and the Ministry of Health, we will have to come to an agreement to be bringing back according to the numbers of beds and so forth that are available.
The fight against COVID-19 is like a steep hill. According to the PTF on COVID-19, citizens should be socially responsible.
Okay, well, thank you very much for that report. Went out earlier, as always, but we used it to set the scene. And we have on Skype our friend Dr. Amadeli Boyo, public health practitioner and social commentator. Good morning, Dr. Boyo.
Hi, good morning, Yori.
Thank you very much, as always, for joining with us. Just about everybody, hopefully, is becoming more and more expert at what COVID-19 really is in terms of what we ourselves can do to sort of help the professionals, help us, talking about cleanliness, hygiene, and all of that. But a new one that has cropped up is this whole business of stigmatization. It's a new one. Why do you think? Because it's a flu. People have the flu. Yes, this one is a very, very virulent flu, admitted. But people come out of illnesses. What do you think has led to this whole question of people being stigmatized?
Yeah, thank you very much, Yori. The reason is that culturally, when our people know there's a disease where there's no cure, and if you look at the Yoruba translation of the disease, any medicine that can, a disease that no medicine can cure. Once our people have that, there's fear.
Okay. And
stigmatization starts. The other thing is the fear that even if you are tested, like now there are testing centers in local governments, and we've seen them on paper. If you are testing people in community health and they have no hope of being treated, then they get scared. 2, the address of the isolation center is Yaba, and Yaba is famous in Lagos for mentally ill people. So patients come and say, I don't want to go to Yaba. I don't want to go to Yaba. The understanding of being taken away for isolation is like being taken to the psychiatric hospital called Yaba left.
Yaba left.
Generally speaking. So they get very, very scared. So the question is, the other last thing I want to say is that most people, the symptoms of COVID-19 is so close to malaria that our people cannot yet imagine what it is. They've not seen it before. We have not been able to show anybody who is sick on TV. So to them, they can't understand what it is. So if somebody has a cough, an itchy throat, or the person has fever, it's not COVID-19. To him, it's malaria, typhoid, and then jadi, that's what they think about. So when you now tell them that it is beyond that, the next question they ask you is, will I die? When they now hear that it's something that cannot be cured, the whole compound, and that is something that if you live with the person that has it, you are likely going to have it. So people get scared. 1, it has no cure. 2, the transmission is easy by touching a door handle, by talking to somebody, by somebody sneezing on you. Imagine you're on a keke now. The keke rider is in front of you. Then the motorbikes, they carry three, they carry two. They can't do social distancing there. So the people are scared of the disease, and so they stigmatize because of their fears, lack of understanding, and the fact that you can be removed from your house and taken to an isolation center. So the people need to be made to know that this isolation center is not a death sentence. You can come out alive. You will likely come out alive. The likelihood is very high. That if you are picked up early,
now, Dr.
and
Boyo,
treated, you will likely come out.
Dr. Boyo, that's where I wanted to come in, because sometimes the terminology that is used, when we say it doesn't have a cure, I understand that there is no known cure for it yet. But people come down with coronavirus, the flu, and then we hear that they are coronavirus free, which means following attention, following medical attention and doing all the right things, they don't have it anymore. What is that? That's not a cure.
Yes, I'm still lack of understanding. The problem is that all over the world, coronavirus kills the vulnerable, elderly, people with coexisting morbidities like diabetes, asthma, and things. They die easily, even though we know children die, young people die. If you look at the Alimoshaw algorithm, you see that in Alimoshaw, 30 to 49 years old are 123, whereas those above 70 are 4. In Alimoshaw, only 4 people above 70. 60 to 69 are 15. The 20 to 49 account for 34, 20 to 29, 30 to 39, 63, 40 to 49, 60. 60 plus 63, 123, plus 34, 157. Now, in a whole local government, most of the people are now young people. And that's why we're very privileged here, because unlike Japan and Europe and US, we don't have a strong demographics of elderly people. And most young people, if they come across COVID-19, because immunity, age is on their side, they will likely be able to, when you take care of the coexisting issues, and you take care of the cough, antibiotics, bed rest, and prevent them from infecting other people, they can. Most viruses can be conquered because the human being is strong and has immunity. But the point is, you should not take things for granted. Why? Many of our people have coexisting morbidities, but they don't know.
Yeah,
they don't know.
That they don't know about, and then because oftentimes you hear when a person might have lost the fight, unfortunately, you hear that was as a result of complications arising from the coronavirus infection. But talking about famous people that have beaten this, you think of the UK Prime Minister, for instance. He came down with it, he struggled with it, and he came out of it. Our president did him a congratulatory message. And then we hear all of these stories. One was thinking, and then also, as you well know, Dr. Boyo, on YouTube, there are pictures of people who volunteer their story, what it was like, and how they beat it. So I think we need to sort of know a bit more that, because doctors, people like you, public health experts, have told us in the past that it's not a death sentence necessarily. And as you just finished explaining, there might be underlying issues. But this whole matter about coronavirus being a death sentence, in the terms of the stigmatization, how do we get that out of people's heads that, look, you can beat this?
The first thing is for us to change the traditional words we used to call this disease. When we say disease that has no cure. That's the Yoruba translation.
Speaking about the Yoruba version.
Disease that has no cure.
Yeah.
You have already sent people. We have to look for ways of going to the grassroots and making them understand that it's a disease that if we identify early, can be able to manage the symptoms with good resistance, people will come out better. So the first thing to do is to change the paradigm, change the narrative of giving the disease a name like the disease that once you catch it, you are gone. We have to start doing that. Because if you look at it today, as at 12 midnight on Sunday, there are only 21 deaths in Nigeria. And discharges 170.
Exactly.
Total number 627.
Exactly.
Now, if you have 627 people and 170 have been discharged, then you can't call it the killer disease, because 21 of these deaths, most of them have been due to coexisting morbidities like heart disease, like diabetes, asthma, cancer. When you have all those diseases, or people on steroids for treatment of some chronic ailments, when you have those diseases, opportunistic infections, viruses can really thrive and have a field day.
So it's your immune system, doctor.
Disease without cure.
It's the immune system that comes under a heavy load, and that therefore is the problem. So I think I've heard experts say that you have to do everything possible to keep your immune system up, even in the treatment, as other aspects of it are being addressed. It's the immune system really helping it to be able to fight off the infection.
Yeah, that's why I've been lucky in this country. I hear people telling me, Nigeria, discharge, 10 discharge, 15 discharge, 419. It's not true. People are getting better because the demographics, unlike in China, unlike in South Korea, Japan, and Europe, the elderly in those countries are huge, about 60 to 70%. In Nigeria, the elderly are very few, because our life expectancy rate, they say 58, and like that. People don't live long in this country. We have people that are 120, 100, 90, isolated cases. But the truth of the matter is that
there's so many religious groups that are going to be reversing what you've just said. Between you and I.
Is worried about now, because right now they've been able to take care of. They've closed the borders. They've taken care of people that came in contact with the first index case. They've taken care of secondary contacts. But now we're beginning to find people in Ikorodu, people in Mushin that never had any contact with known cases. That's what we call community transmission. So the stigmatization now is that people will tell you, I never saw Italiano. I never had any contact with the Chinese. But they should begin to know that there's a spread within the community that is beyond contact or beyond traveling abroad, contact with a foreigner or something. There is already embedded in the system community transmission. We have missed cases of the virus, and this virus is going on in the community. Of one word, asymptomatic carriers, meaning people that have the disease, but their immunity is strong enough, they are COVID-19 positive, and they're going about smoking, drinking, and laughing. And so people don't know that they have the disease, and they easily relate with them. Thinking that it's like HIV/AIDS. It takes some years for HIV to progress to the acquired immune deficiency syndrome. You can have the virus, but it may take some years before you even begin to manifest the symptoms. When people manifest the symptoms, they run away from them. But now, the asymptomatic, meaning people that have the disease but are healthy everywhere and they're moving about, they are the ones that are now in charge of this community transmission.
Okay, well, thank you very much, Dr. Boyo, for joining us as always. We also we appreciate your perspectives. Thank you very much. Well, there you go. We also we'll be speaking with Mr. Yemi Makwadiono, and indeed we still have Franklin Isong to speak with. Okay. In fact, we have Yemi on phone, Mr. Makwadiono, governance and strategy expert. Good morning, Yemi. Thank you again for joining us. Okay, while we're trying to sort that out, but we really had a very good time with Dr. Amadeli Boyo, and we just hope the technical aspects of the broadcast continue like that. Of course, this is all coming from what is happening all over the broadcasting world now. As much as possible, people are doing remote, guests, into
companies
studio.
have gone into virtual
exactly.
Conference.
And even you see that where reporters have to be on the field, they're using boom arms, which is very unusual.
Yes,
Instead of holding the mic, they have a boom arm that usually, you use so that the mic doesn't show in short. But now people are using it, let it show. It's about maintaining a very safe distance. So we'll be getting EMA soon. But the things that Dr. Boyo was pointing out there, food for thought. I understand Mr. Makwadiono is back. Good morning, Yemi.
Good morning, Glory.
Great to have you, sir.
My pleasure.
Indeed. Well, I don't know if you heard it with, we heard our conversation with Dr. Boyo, and the challenge that we face with the attitude of people now to the whole coronavirus. We have people, well, the word isn't quite escape, but abandoning isolation centers. People have used the word escape. And then we have situations where authorities are saying we have them back in our care. So the whole thing is taking on a different kind of complexion. Yet people just, where they need to be is where they can be helped the most. And people are getting up and taking a walk. What can we do about this? In terms of policy, in terms of strategy, we have governments, they've put the best healthcare possible that they can put, and now people are walking away from those isolation units.
Well, let me just start by saying that this whole issue of COVID-19, every Nigerian should understand, just like everybody in the world, that this is a real and present danger. It amazes me that there is still a very big chunk, of Nigerians who actually think, or believe that they are immune from COVID-19. That is, if they, admit that it exists, at all. And that is why I think that we actually have an issue of mixed bag here, because you are talking about stigmatization of people, and then on the one hand, and then on the other hand, you have those who don't even believe, that this exists. So I think there is one common thread, between these two, and that is ignorance, and that is why learning from the experiences of the severe acute respiratory syndrome outbreak of 2003 and the swine flu of 2009, public health authorities, have identified effective, transparent, communication, public communication as very, very key, to tackling future pandemics. And so we have one on our hands now. And I think the way to go is to accelerate, our level of communication. Yes, there is a whole lot of information out there, sometimes conflicting, information. In fact, somebody said, apart from, having this COVID-19 pandemic, that we also have another big issue on our hands, which is infodemic. So we have so much information around that it has gotten to a point that people just choose, to live by the day. And by doing that, they're further endangering, their lives and the lives of other people. Because this is not just about the individual that is infected now. It is the potential of that one individual of infecting thousands, even within a few days. I mean, I recount that by the middle of March in the United States, we had just a little over 1,000 cases. A month later, we have over 700, close to 800,000 cases in the United States. And so when we even come back to Nigeria here, we will see the exponential increase, in the numbers, even though the numbers don't appear staggering yet. But if this trend continues, we may find ourselves in a very difficult situation. And that is why I think we need to accelerate our information dissemination system in a more effective manner, so that it can reach those who are most prone, to these diseases, who, on the other hand, think they are immune to it.
Thank you. Because so much so, what you've just said, you see in other, we're doing our best ourselves too, but take, for example, you talked about the U.S., talking about UK, maybe some other countries around Africa. You have the very, very highest people of society coming on and singing it like a broken record, if you like to put it like that, how you must stay home, appealing. And so there's a singular message that is going out, and of course it will be supported by all sorts of other messages within, because the professionals know how to, come up with these things. but there's a singular message in other areas. Right now, we've said here that maybe we can do things to improve on that, to sort of enlighten the people more, so we have less of the kind of situation where people don't know exactly what they're dealing with, or, as you said, we're in lockdown, you have time on your hands, people want to be helpful, and people are busy passing around all sorts of information that people are actually finding themselves having to consider instead of being in a position of strength as far as information is concerned, because it's been concerted and it's been targeted and it's been directed to them, and so they can say that this is the fact, this is the truth, never mind any, there's that aspect of policy perhaps that, do you think we've done what we need to do, or could we do better in that regard?
Well, you see, Mr. Ori, this issue is very critical, and I want to believe that we need to target, the educated elite, in Nigeria, the community leaders, the opinion molders. And the only way to harness all of these people together in an integrative manner so that we'll be speaking the same language is for, those in governmental authority, those who are in charge of communication, to find, a strategy of focusing everybody's attention to the seriousness of this matter, rather than talk about some other less important, or the same important issues. Because I hear people talk about hunger. I see professors tweet, about hunger virus being more damaging than COVID-19.
Yeah.
I see very enlightened.
We're making light of the situation.
Benefited from the Nigerian system, who are playing politics,
Thank you very much for that, Yemi. I'm afraid I have to rush you a bit because I must go on a break, but I take the point you are making that we just have to get a lot more serious about this. Thank you very much, Yemi Makbadirun. Okay, stay with us, please. We'll just take a break and we'll be right back. Okay, I understand that Yemi Makbadirun is still on there. Yemi, thank you for holding on. I understand we still have you on the phone line. Perhaps not.
So the issue you raised about the massive amount of information that is out there, but my concern is that this information is not coordinated. And it's not focused in a way as to refocus the attention of people that this is an emergency, and that during an emergency, you need to have concerted effort so that the period of the emergency can be cut short as much as possible. I have a strong belief that if we have used the first 2 weeks of lockdown responsibly, we probably will not have to extend by another 2 weeks. But as it is, I'm afraid that at a point, government will have to be faced with a dilemma of either opening up the economy and then exposing the population, to an exponential increase in COVID-19 cases, or continue to sacrifice the economic growth, for public health interest. And so that is why every one of us needs to know that these are not normal times. This is a period where if you are used to having 3 meals a day, you now have to scale it down to 2. And you must expect that this can last for as long as possible. During war, nobody talks about palliative because everybody, even the government, is focused on funding the military to ensure, they win the war. So as it is, let us not prolong this lockdown by irresponsible behavior, both by those in power and even by the populace.
All right then. Thank you very much, Yemi Makwadirun, strategy and governance expert. Thank you very much for joining us. We also have standing by Mr. Franklin, well, Comrade actually, I think I should say, Comrade Franklin Isong. He's Chairman Civil Liberties Organization in Akwa Ibom, with the Akwa Ibom chapter, joining us by Skype. Well, good morning, Comrade.
Good morning.
Okay. We wanted to speak with you, maybe tell us what you know about reports that some health workers have actually fled their duty posts because of fears of coming in contact with infected patients in an improper kind of a way in terms of their own personal protection.
Yeah, I think we got the report as well as a group, and we started to investigate. This morning, while coming to the office, I heard an interview over the radio with a member of the Nigerian Medical Association (NMA), who was also asked the same question, and he said, if it's true, it means that the workers, the doctors, are not given their.
Okay, so this therefore is
members to be well kitted in order to be able to combat with the disease. And the report we gathered was a pathetic one. In fact, it even involved a medical doctor, from what we learned, and it's a sad one indeed. It's a sad one. We are calling for a full-scale findings to enable us to know what really happened, because we are suspecting that there is no communication between the COVID-19 case COVID-19 case management committee and the management of the hospital. That is what we are suspecting. So until now, we've not been given a full detail of what actually transpired at that hospital.
Okay, Comrade, I'm here with my colleague Asukwo James. You know, and Asukwo, did you have a question?
Franklin, you said something. I think we had a little bit of challenge getting. Are you saying that a doctor actually died being stigmatized, or he was abandoned?
Yeah, the report we actually had doctor who had been treating himself in his private hospital, got worse, and then he was taken to the hospital which had been assigned as one of the isolation center. But on getting to the hospital, the doctors on duty refused to admit him until calls were put across from authorities in the state before he was admitted. And while he was being administered with treatment, he passed on. And so we don't really know what transpired. But the report we are getting is as if there is no cordial working relationship between the COVID-19 management committee and the hospital management committee. So we don't know what really happened. But that is the report we are gathering. Whether it is of stigma, whether it is of the fear of the disease, we don't really know what transpired. We are expecting to hear from the government.
So in terms of awareness, how aware are the people? Because I heard that in Akwa Ibom, where I come from anyway, some people see it as being COVID as being witchcraft. So are people really aware? Do they know what COVID is all about?
I think the government is doing its part with regards to awareness. And I think there are jingles running now on private radio stations where you have the three major ethnic groups being informed with their various languages. The issue of stigma, the issue of the witchcraft syndrome is no longer in vogue here in Akwa Ibom. That had been long gone in Akwa Ibom. I think the people are actually aware, but we need to do more aggressive campaign, more aggressive house. We need to we can use for leaders.
Okay then. Well, Comrade,
down in the may not actually be informed of what is really happening. I think that by the with lockdown that we have had in the state. People are asking questions why the lockdown, and then those who are not aware of the disease would have been told that why we're having this lockdown is because there is a disease that when you come in contact with whoever that carries it, you are infected. And so with this, the message is being taken down to the rural areas. But I think that the government needs to do more in the area of updating the citizens with day-to-day information. We need to keep abreast. We need to have daily interface with the government agencies and those who are managing this disease. For example, we had a case where you have several channels of information coming from government. You will hear from the SSG, you hear from the Ministry of Health, you hear from Commissioner for Information, and sometimes this information comes in different ways. And people keep asking questions. Why don't we have a single form of information where it comes from one channel? And this will help to send down the message. So far, I think the people are aware to some extent.
Thank you. Comrade Franklin, I want to thank you very much for joining us. Comrade Franklin is the chairman of the Civil Liberties Organization, Akwa Ibom chapter. Thank you very much, Comrade, for joining us. Okay, and then moving on. Okay, something we haven't been able to do for a few days, but I think we'll take a stab at it today. That is the regular part of the program, which is your program actually, and that's where you get to call in, and so we can know what's going on, you know, in as it were, your side, in terms of this whole COVID-19 war, because people have said it must be seen as a war. The enemy forces, of course, unfortunately, are invisible. But that's why it's very, very, very important to have a sort of a strategy as to how does one do battle with it, and hygiene is number one, is what we know that. And then habits, we just have to learn new habits. Social distancing, yeah, we're Africans. Yeah, we perhaps more than others, we socialize a lot. We need to be with each other. But I don't know if it's just about being African. It's about being a human being. Now we have to learn that, sorry, no hugs, no kissing, no, all the things that we just have to learn to rethink the way we live our life socially. Now, I don't know that we're doing very well when you walk around town.
No, exactly.
We're not doing very, very well at all. I don't think any medical person is going to be happy.
You know, we are not doing well at all. Even you can see the doctor, Dr. Boyo, actually said something about bikes. You know, it's as simple as that.
Yes.
Now bikes are not even.
One moment, please.
They're not carrying
one moment, please. Let me take Yakub, who has called in from. Yakub has relocated to Ifo. Good morning, Mr. Yakub.
Yeah, very good morning, sir.
Thank you for calling in.
Thank you for the information you are giving to Nigerian citizens.
Yeah.
Chief, let me begin by saying that I give kudos to Lagos State government because they are doing a very great and very good job. In the part of the test, you can imagine the systematic of testing the Lagos State is using now for decentralizing the testing area to the 20 local governments, if I'm correct, so that people that are feeling the symptoms, whether, as I said earlier before in the last week, whether the person has a malaria or it is COVID, he does not know, he or she does not know. But if the test is close to his or her area, he will voluntarily go there and he will drop his blood, and then he will be waiting for the result. So I'm using this opportunity because I know people close to Governor of Ogun State, in person of Dapo, Executive Governor of Ogun State. They are watching this program. If they can take a crew from Lagos State to do the same thing. As at yesterday, if I'm correct, maybe they are reporting 12 or 13 coming from Ogun State. I'm not really sure it's just 13. Why? Because Ogun State is very, very close to Lagos State. Because if they can be able to do the same thing, as I'm talking to you today, Chief Yori, do you know that Ogun State always leave this ban every 3 days for people to move around, to go to market, to go and buy. As I said last week, if you go to, in fact today, as I'm talking to you, if a market is open, people are going there to buy their daily needs. See, Chief Jolly, if Governor Dapo Abiodun can be able to take clue from Lagos State and then All the work that Lagos State is doing, if Ogun State does not do the same thing, it's going to amount to nothing. Why? Because people still come from Lagos State. I don't know where they follow. They are not following the express again. They are following inner street. And then they will leave to Ogun State, and then they will carry people from Ogun State, enter Lagos at the same time.
Okay, Yakub,
So basically,
Yakub, we take note.
Is that
we take serious note of the points that you have made, and you see, it's all about we have to be armed with knowledge, and for the moment, our people, they know because we're telling them, but they don't really know. If they knew, we wouldn't be doing what we're doing. We don't see each other as potential dangers to ourselves. No, that's my friend. I've known him since we were in primary school together.
Exactly.
You know, we are together in the office. Look, please, it's so simple once you understand it. They say they want 2 meters. Let's do that, 2 meters. The droplets, which is the only way you can get infected, it's not a long jump, over a champion.
It's just like this.
It's not a long jump champion. It can't travel 2 meters, 6 feet.
It will be floating.
You know, gravity will bring it down. So we just need to know all of this. A call is coming in from the UK. Chris in the UK, good morning. Okay, the call is coming in from the UK. We have someone from the UK. Prince in the UK. Good morning, Prince.
Yeah, good morning, Uncle Yemi and
good morning, sir. Thank you very much. I'm alongside Asukwa James.
Good morning.
Yeah, good morning, Uncle Yemi.
Good morning, sir.
Yeah, thank you for the good job you guys are doing there.
Very kind.
I just want to appreciate you guys and also chip in a very few contributions.
Okay.
I think our major problem in our country, Nigeria, is our government, the leaders. I don't know if you watched the burial of the chief of staff, the chief of staff of the president, the burial that took place in Abuja. As we all know,
Prince, can you hear us? Prince, I believe this has become a one-way communication thing. Prince, if I have your attention now, Prince.
Yeah, I can hear you.
Okay, thank you very much. The theme, we're talking about stigmatization. You know, there's so many aspects to this. We're talking about the stigmatization aspect to this war against COVID-19. And, you know, do you have, for instance, such stigmatization over in the UK in your experience? Because I was making the point that people who are battling the disease actually come out and talk about it. And here we're having a stigmatization issue. That's what we want you to talk about, if you will.
Yeah, I mean, okay, I'm sorry if I digress, you know. However, this is part of the problem that we have that is itching us there. I mean, at the end of the day, one of the problems we have is the mentality. You know, people will have a kind of illness and they don't want to disclose it to anyone, even closer family members, because they don't want them to know about this, about that.
Is that the way it is in the UK?
However,
Prince, you are in the UK. Prince, you are in the UK. Is anything similar going on? Is that this? Do we have a similar attitude like that in the UK, for example?
Never. You see, here in UK, no. Here in UK, the system is already set up, and they are following the system. When you call the phone number that you're meant to call, or you call your GP and tell them the symptom you're having, people comes in to attend to you. They don't even want you to get to the road. They will ask you, please stay at home, and somebody comes to look after you.
Yeah. And people don't feel ashamed. People don't feel ashamed about the condition over there.
And then everything, if you're vulnerable, that you are not able to come out, the government puts your name in the list without you asking for it.
Okay.
And then the same people that will deliver food to your doorpost, then send the medical people to come to attend to you. Every single thing that you need, you get them.
But,
for instance, I work in a company. I've not been to work for the past 3 weeks because the company is shut down. However, I am going to get 80% of my salary.
Okay,
sitting at home.
that's all very well and good, Prince. Thank you very much for calling in. We have a problem with the line because I really wanted to really learn from Prince's experience with of what stigmatization is in his environment over there in the UK, because that's what we now find ourselves having to combat. But I don't think Prince heard me well enough to be able to address the issue. But I don't know.
He said never. He said some stigmatization is not.
Yeah,
you know,
because Boris Johnson has just come out of it. A lot of people that are not Boris Johnson are also coming out of it.
And they are sharing
there's no stigmatization.
Testimonies.
If you want,
yes.
yeah. Let us call it.
Let's use that word, because.
But we also have people here. Lagos State government organizes, the people that are going to be discharged or that have been discharged. They show themselves. They've beaten it.
Let me even use one prominent person.
Sure.
Bukola Olakpade.
Okay.
There is nobody that.
Okay.
Most
This
Nigerians,
one-time commissioner for sports in Ogun State.
Yes. And is deeply involved in the Lagos Marathon.
Yeah.
So he's someone that has been out talking about his experience. He has been sharing his experience, and so people should not think COVID is a death sentence.
This is the point.
He has been there.
But unfortunately, you see, part of it is because of the sense of stigmatization. There are those that are not reporting themselves, that are not isolating. That are those that are trying to go to private hospitals, which is an absolute no-no. You have to be specially accredited. But let me bring in Benga in Abuja. Good morning, Mr. Benga.
Hello.
Good morning, Mr. Benga. Good morning.
Yes, my name is Benga from Abuja.
Go right ahead, please. You're on now.
Yes, Mr. Yorin and Asukov, you should know that this disease is still a novel disease in Nigeria. People have not known much about it. Number one, some do not believe it exists. And those who believe it see it as a killer disease. So for us to resist stigmatization, those who have been cured, who have been treated, should be given some space to come on a TV like this and talk to Nigerians that this is not a killer disease. We can survive it.
Yeah.
By the time people get to know that, look, this is not something like if you have it, like it's HIV, you are already condemned to death. People will come out fully. I'm telling you that there are people having this thing and they're hiding it. They don't want to come out to the government to say, I have it.
Even HIV, there are people living with HIV. There are people living a full life with HIV. And I think we have to be careful how we talk about these illnesses. I'm sorry to be speaking over you. But you see, we have to be careful how we raise these things. Even HIV is being properly managed, but we're not talking about HIV now, but there are people who are living full lives with HIV. But I take the point you're making that COVID-19 is not a death sentence, and we want to emphasize that. And thank you very much for your contribution. But it's just that I had to go there when you were comparing it and saying it's not a death sentence like HIV. Even HIV isn't necessarily these days with where Medicare has got to necessarily a death sentence. But I take the import of what you were saying. That was Mr. Gbenga. Thank you very much for calling in. So the Lagos State, to go back to Lagos State again, they show us people, that is people, not so much Lagos State shows us people. The people want to cooperate. If the people didn't want to cooperate, they can say no. You can't show me against my will. But these people are happy to be well again, to be free. They've done all the tests. They've tested negative first time, second time, and so they're saying we beat it.
In fact, the first person that even came out, what is her name? Showubi.
Okay.
She granted us an interview.
Exactly.
You know.
Exactly.
And she even shared her experience when she was in the isolation center.
Yeah.
How she was properly taken care of.
Yeah.
You know, that at some point, the food they were even giving her, she was begging that is enough.
Yes.
You know.
Even, I'm reminded of the medical doctor, even when we had Ebola. Of course, unfortunately, we lost Dr. Adedivo. Adedivo, may her soul rest in peace. But we had other people. There was another young doctor, her name escapes me now. She survived it, and she came out and told us the story about it. So people should be encouraged, you know, by all of these. But Dr. Boyo sort of put it in perspective of why people might be making the mistake. The whole, in Yoruba, the medicine that does not have a cure, I don't know why they've gone that way in terms of
there's a great danger in stigmatization, which people don't know. When once somebody is infected and is at home, or somebody is even healed of COVID, and we are stigmatizing against that person can end up in mental illness.
Yeah.
By the time someone is discharged and somebody is saying that person is a COVID, you know, and nobody wants to associate, it can lead to mental illness.
Anthony has come on the line. Anthony in Anambra. Did I get that right? Good morning. Anthony? Yes, I did.
Hello.
Good morning, Mr. Anthony. Good morning. Can you hear us?
Yeah, good morning, sir.
Okay, go right ahead, sir.
First of all, I want to quickly thank you for the job you are doing.
Very kind of you.
I think TVC is actually doing a great job in sensitizing people.
Thank you.
But coming to the matter, if you look at this issue of stigmatization,
yes,
it has a lot to do with education. The level of illiteracy in this country is just too high. A case study of okay, let me not even go through the illiteracy aspect of it. Let's
and be very brief, please, because you're our last caller. Be very brief.
The medical doctors,
please be brief.
And the nurses. Yes. I was reading through a case, although the authenticity is what I'm yet to establish. Hello, sir.
Yes, we can hear you. Please be brief. You got about 30 seconds more.
Okay. So there is a case in Anambra, in Enugu, that I was reading online. I'm yet to authenticate it, where a guy was lamenting how his wife died. How his wife died in the inside a car, right in front of a hospital.
Okay.
Why? Because the doctors, the nurses, and all the personnel on ground are all scared to attend to the wife. And the wife is having a heart issue or something related
an underlying
to
condition
affecting her brain.
That makes her more vulnerable.
And people fail to attend to it. So imagine that family. Would any of them having symptoms be ready to go to the hospital?
All right, then. Thank you very much, Anthony. Appreciate your calling in from Anambra State and, you know, raising this crucial point. We just have to arm ourselves with better information. That will then enable us to do the best in terms of keeping ourselves safe, and then much more importantly, you know, how to just, you know, spread that knowledge around. We've run out of time now, but you know, that's our program today. Please join us tomorrow for a fresh edition. Asukwa, James, and I will say see you tomorrow, God willing.